Dr. Aastha Chugh. Dr. Aastha Chugh is registered dentist and a passionate public health professional working as research officer at HRIDAY, and through her work has contributed immensely to tobacco control research in India at this age, including her work in Tobacco Industry Interference Index. So Astha will be talking about monitoring exercise that has been undertaken through these index. Over to you, Astha.
Thank you, Dr. Monica, and thank you everyone to actually set the pace for this index that we conducted for over 2 years, and this year Dr. Upendra Bhujani has conducted it. So though various monitoring exercises have been done even at the state level regarding just to know about what are these tobacco industry interferences and what are the industry tactics, and then to overcome that this TII index was the first monitoring exercise that was done at the national level. It was done at the national level first in 2018, where we collated the tobacco industry in incidents for the year 2017. So this was based on a standardized tool, which is the CETCA tool, Southeast Asia Tobacco Control Alliance tool, where we get a set of, there are a set of guidelines, and this tool is generally used by various countries. And then there is a predefined broad search strategy, of which we did a search of these tobacco industry interference incidents on Google search engine, on industry websites, on various media reports, on various articles. And out of which in 2018, this index had 20 questions for which these incidents were recorded. And there was a scoring scheme that was given by CETCA to score and to analyze what is the progress on this 5.3 implementation in different countries. And India was, of course, one of the country. So there were 20 questions, and there were like 7 themes. For example, the level of industry participation in policy development, CSR activities, transparency, preventive measures, etc. But here I'll talk about more about the comparison of all the three indexes that have been done in 2018, 19, and now in 2020. So the earlier report, the first report that was done, it showed a score of 72 that India gained, and this index was included in the Asia TII index released by CETCA. And over the years in 2019, the score lowered to 69, and now in the third TII report, the index scores has lowered to now further to 61. So there has been a constant decrease in the incidence of TII and in the lowering of the score. So this CETCA actually, the scoring guidelines are as such: when there is a lower the score, the better is the implementation of Article 5.3 in a country. So showing this lower scores is actually reflecting upon what have been the achievements in India, and but the consistent things that we have observed throughout the years in these three reports have been something on CSR activities, as Dr. Upendra Bhujani also mentioned in during his talk. So even in the report, we observed that tobacco companies actually proliferate, and they try to build their positive image by proliferating into different sectors, and then leading some health initiatives then they invest into waste management, they invest into women and child health care, they are into promoting health sanitation. So that ways it's an opportunity for the industry that has been consistently shown in this index. That is something why there is a high score on this particular segment, that the industry is proliferating because of their CSR activities, which is allowed to them by investing 2% of their profit shares into CSR, this so-called social corporate responsibility in other sectors. So that is a very great matter of public health concern, because where once we talk about the conflict of interest, on one side this industry is taking so many lives, and then they are conducting these health and wellness events where they where they're actually promoting a positive image about themselves. And also one more thing that we observed, that which have already been talked during the session, is regarding the conflict of interest and with the different agendas of different ministries. So on one hand, where the Ministry of Commerce is proliferating and is trying to promote tobacco, the Ministry of Health is doing endless efforts to control and derail, endless efforts to promote tobacco control. So there have been a conflict where there have been issues which have been shown in the index regarding the transparency and the prevention measures, and particularly regarding the absence or the lack of national guidelines which were not there during these years, because of which India has gained a very high score. But just to summarize some of the reasons I would like to highlight because of which the score has lowered is also because various efforts are being taken at the state level. Various state governments have issued, 14 state governments have issued 5.3 guidelines in their states, which which has actually taken into consideration when we were doing this record, when we were doing this index, and that has actually lowered the score from 72 when we did this index for the first time in 2018, and now in 2020 it has lowered down to 61. So some good progress that has happened, and also because of the whole of the government approach, where this empowered committee is present in various states, and this empowered committee has different the different ministries present in them, and they are effectively working on these guidelines. So that is also a reason why the score has lowered down. And also some of the trainings which have been initiated during the NTCP for sensitizing other departments, not only the Ministry of Health, regarding the 5.3. So though we need to do a lot regarding 5.3, but yes, there have been some work, and which has shown in this exercise, in this monitoring exercise over the years. But yes, that is something that is greatly can be highlighted, that the score has lowered, but yes, we need to focus, and there is a this code of conduct at the national level will be a very useful tool, that very useful thing, that over the years, if we do this exercise again, it will be very interesting to see how effective it is and what are the modalities under that as well. Thank you so much, and thank you for this opportunity.
Thank you.